Thanks for giving me the opportunity to participate in this meeting. Big thanks to Catherine, Amy, and Elaine for putting it together. I think it's timely and important that we talk about these things. I'll open with a few brief remarks about where we are now, and then we can open it up so there's enough time for discussion. I won't take long. I'll start by saying that there have been significant shifts in the geographic distribution of COVID over the last few weeks, but North America still leads, particularly America, with 20 to 25% of the world's total number of daily new cases. Europe, I think, is second with 15% of daily new cases at this stage. Brazil is quickly catching up, unfortunately. But we have done very well here in Connecticut, particularly in Reading, while cases continue to rise in other parts of the country, largely because of early relaxation of social distancing measures, early reopening of businesses, et cetera. We are way past our peak here, which is really good news. Particularly in Reading, we have seen no new cases of COVID in the last 11 to 12 days. And this is because the majority of us have done a great job of social distancing, wearing masks, washing hands, et cetera. To date, Reading's total confirmed case count is 66. 3, unfortunately, have died. By way of comparison, Ridgefield has had 209 cases to date, Wilton has had 179, and Danbury has had a total of 1,784 cases. This data is as of yesterday, so there may be some slight changes in terms of Danbury, but as far as I know, nothing more local than that. Hospitalization rates continue to drop as well, and as of their last staff communication, Danbury Hospital currently has only 23 confirmed cases of COVID in-house, which is really great. It's way down from its peak earlier in this year. Very encouraging news. That said, it does remain critical that we continue to practice good hygiene measures, use masks when appropriate, continue with social distancing in order to remain ahead of this curve, and to adhere to evidence-based guidelines in general. So we need to continue to listen to the scientists and the researchers and the doctors and grown-ups in the room. As you probably know, Governor Ned Lamont has just announced specific rules for phase 2 of Connecticut's reopening. This second phase will take effect a week from tomorrow, actually, June 17th, I believe is the date, Wednesday. He has stressed that the decision to reopen during this phase is ultimately up to each individual business owner. No one is required to choose to do so. But if they do, they need to follow the rules as prescribed. There are lots of rules. If anybody's interested, there's a link that I can provide. Somebody can just shoot me an email. I'd be happy to provide that stuff. But basically, the phase 2 of this plan involves the following sectors. So far, we have amusement parks, hotels, indoor dining, indoor museums, zoos, and aquariums, indoor recreation facilities like bowling alleys and movie theaters, limited capacity. Libraries, outdoor events are opening up again, personal services, nail salons, tattoo parlors, and the like, they're going to be allowed to open. And sports and fitness facilities like gyms, fitness centers, and pools are going to be opening as well. Most experts anticipate that the COVID virus will remain with us until a vaccine is available, and that perhaps we will see some future waves of COVID, most likely as cold and flu season emerges later in the fall, or perhaps even sooner as businesses and facilities reopen. There's really no way to know, but everyone is asked to stay on their toes in this regard. In order to even hope to mitigate this potential wave or to minimize the number of cases moving forward, we need to not let our guards down and to continue to practice the same safety and hygiene measures we've been practicing so effectively so far. In my opinion, one small silver lining around all of this is that if we continue to practice these measures, it may help us to mitigate the upcoming flu season. Fewer flu cases and less illness in general, at least to some degree. So I think there's some potential good news there out of what we've learned. A lot of measures that we've employed in the last few months, in my opinion, should be employed indefinitely. I'm not talking about wearing masks for the rest of our lives or social distancing for the rest of our lives, but regular hand hygiene and perhaps changing some social norms like regular handshaking may be worth considering down the line. People have already begun to adopt this line of thinking, and I think it can only help us in the future. and perhaps make a huge difference in terms of the long-term health of our communities. Lastly, I'd like to use this opportunity to briefly touch on the importance of disease tracking and contact tracing. I'm sure you've all heard something about this. There are numerous contact tracing tools out there, mostly people reaching out to those who have been diagnosed to talk with them in order to ensure that those with whom they may have been in contact are safe. These programs remain confidential and strictly voluntary, but they are critical in enabling us to remain ahead of the COVID curve. So if someone gets sick with COVID, they may get a call from someone asking that they be allowed to inquire as to recent contacts and locations and so forth. But again, strictly voluntary, very important, and confidential. Disease tracking mechanisms are also important, and we're going to be seeing more of these for sure. One such tool, which was endorsed by Ned Lamont and by the Connecticut State Health Department, is an app called How We Feel. It's really easy to use. It involves a quick anonymous daily check-in to answer a few basic questions about how we feel. And they use this data to try to determine where disease may be headed. It's a free app. It's easy to use. It's an anonymous daily check-in. And it asks a few simple questions. It takes a couple of minutes and you're done. It even has a little reminder function to enable you to remember to check in without having to think of it on your own. So I would encourage everyone to download and use this app. It's a real no-brainer, and it can be very helpful. Again, it's called How We Feel. It's on the iPhone store as well as the Google phones. So that's really about all I have to say. I'm happy to open it up to questions and comments. If anybody has anything they want to say or ask, I'm all ears.
Thank you, Larry. Would anyone like to start us off with a question? We did have some people submit them in advance, so maybe we can start there.
Sure.
I know, let's see. There were questions about the Pandemic 101 video about the vaccination and whether the Dr. Daulaire on the video had said that best case scenario would be that it would be available to U.S. residents within 18 months to help build herd immunity. And do you agree with this as being the best case scenario?
I think it's, anything's possible, and there are people who are very optimistic and working very hard to get these vaccines developed and approved. But the 18 months is a very contracted time frame for vaccines in general. It would be record-breaking if we were able to get something up and running prior to that time. There are a number of companies that are working on vaccines, and there appear to be some really good candidates in the pipeline. And the other bit of good news is that preemptively, a lot of these, the government and some companies have already begun to get the supply chains in place so that when the vaccine is ready, that step that normally occurs after the fact is already taken care of. So once a vaccine has been proven safe and efficacious with not a lot of side effects, it will be made available more quickly because of those efforts. But we're talking about supplying the world. Really, in order, when we talk about herd immunity, for those who don't know, that basically means that if 60 to 80% of people in a given community are immune to a disease, either because they've already been exposed to it or because they've been vaccinated, that then makes that particular infectious agent much less able to penetrate that particular community. So when we talk about herd immunity, we talk about a critical mass percentage of people within a community who are immune. And in order for that to work nationally, it really has to work globally, so, it's not as though there's going to be a vaccine available to Connecticut residents, but not everybody else. It's going to have to be an immense global effort. And so I think a year to 18 months is probably realistic.
Thank you, Larry. I know we also have some questions about, is it worth getting the antibody testing? And
very good question. Yeah. Was there more to the question?
No, that was it. Yeah.
Okay. I'm asked it all the time by patients and others. There are various technologies out there that are doing these antibody tests. None of them just to be clear, even the ones that are most robust are FDA approved or fully independently vetted at this stage. Many of them have received emergency use authorization for the FDA, which means that they have submitted some data which suggests that they are reasonably accurate and effective, but there are still unknowns about the results. We don't know to what extent there may be false positives and false negatives, meaning that an antibody shows up when in fact it's not really an antibody to the coronavirus, or perhaps someone who definitely has had coronavirus still may not necessarily present with antibodies on their blood tests. So, you know, we question whether or not the tests are as reliable as we'd like them to be. I've looked over the data from a couple of the companies. There's a test that Abbott has put together that's being used by, I'm not sure what machines Danbury Hospital is using. I'm also on staff at Stanford Hospital. I've been in touch with them, and they are using a machine by Abbott, which has been fairly well vetted and appears to be pretty sensitive and specific. It's also, they're using the same technology with Quest Labs. The Quest Labs use the same technology. So I think probably it's safe to assume that these tests are reasonably accurate. But the other bigger problem is that even if somebody has the antibody, and you may have heard this number already a number of times in the news, we don't know to what extent that antibody confers protection. So you can have an antibody and it may work, it may be helpful for a matter of weeks or months, or maybe not at all. If someone's bombarded with a huge second dose of coronavirus, those antibodies may not be sufficient to do the job. That said, people do want to get these antibodies, and you know, after an informed discussion, for my patients, I'll order it for them, as long as they understand that it's not going to change how we manage things for the time being. If you have an antibody, I'm not going to tell you it's okay to stop social distancing. I'm not going to tell you it's okay to stop wearing a mask when you go to the grocery store. Nothing really changes in practical terms until we know much more about the implications of these results.
That's very good advice. Thank you. We did also have a group of questions about schools and what kind of testing is needed and what type of cleaning would need to be done for the students, what testing.
Well, there are a lot of embedded questions in there. I'll try to kind of approach it systematically. We know that we believe that the schools will open in the fall in some form or fashion. We don't know, there has been no announcement yet as to when. There certainly has been no plan put in place for testing students or families of students. In an ideal world, we would be testing, if not everybody, certain segments of everybody on some kind of a regular basis in order to be able to track disease, as I was talking about before. Probably the best disease tracking mechanism there is regular testing of populations or segments of populations. Currently, we don't really have the resources in place to do that, although testing is currently more and more available. It would be nice if there were some plans in place for the public schools. I know that my daughter just finished her freshman year at BU, Boston University, and they just announced that they will be opening in the fall. They're going to have a series of modifications that will make it as safe as possible. And at the university level, there are plans to test students on a regular basis. So it would make sense to be able to do that. I just don't have any answers right now as to whether or not our local schools will be planning something like that. It would be great if it were planned for students as well as the population at large, but time will tell. As far as cleaning and surfaces and so forth, you might have heard some things in the news lately about surfaces being potentially less problematic than originally thought. There remains a lot of debate about that. I would say that, and nobody is saying that surfaces are irrelevant. Some people are saying maybe not as concerning, but they still need to be taken into consideration. So again, I wouldn't necessarily change any behaviors in terms of surfaces. So I do think that some form of decontamination on a regular basis will be important. And as we learn more about the ways in which these viruses are transmitted, we may need to modify those plans over time. I certainly think that in the younger age groups, kindergarten or maybe K through 5, where kids have their hands on their faces and in their mouths all day, I think surfaces are critical. Maybe a little bit less so in older age groups and perhaps in the community in general. So we'll have to see how that goes. But I think decontamination on some kind of regular basis will be a part of the plan. Was there anything else? Was there any other part of that question that I didn't?
Well, there was one. It says, I know there are some infected people who could be transmitting the virus but don't have a fever. I've read that this could be anywhere from 20 to 70% of infected people. Do you have an estimate of the percentage, and is the temperature check still worthwhile as a screening tool, I guess, in the schools? In general, we believe that a significant percentage of transmission occurs by people who are either asymptomatic or pre-symptomatic. You know, maybe they're a little tired, some mild symptoms that might otherwise be dismissed. There was a news report recently about perhaps the WHO, I think, made an announcement that they feel that asymptomatic stress is less of a concern. But the minute that came out, a whole series of arguments evolved around whether or not that makes sense or not. Most people in the field believe that asymptomatic or pre-symptomatic spread is a real thing. It would be great if, like many other illnesses, it only transmitted when people were symptomatic. It would make it much easier to track. But that's one of the things that makes this virus so difficult to track, is that we know from experience that there is a significant amount of asymptomatic spread and that there are a significant amount of people who never develop symptoms who test positive and who may be able to transmit to others. So it's complicated, but I would say that asymptomatic spread is still a concern, and we need to continue to take all proper precautions accordingly with hand washing and masks and so forth. As far as temperature checks, because many people are asymptomatic, a certain percentage are asymptomatic, and it may be up to 30 or 40% of people. Temperature checks, it's a very blunt instrument, because many people who have the disease will not exhibit a temperature. I will tell you that as I reopen my practice, we are routinely using an infrared forehead thermometer to check every patient before they walk in the door. Those are the guidelines. And if in the off chance we catch somebody who has a low-grade fever, it would be very helpful. But it in and of itself is not a particularly useful tool. In combination with a series of questions, screening questions about symptoms, where people may have been or who they may have been in contact with, adding a temperature in can be helpful. It's one more data point. Thank you. Thanks. Another question is, what do we know about the long-term effects of COVID on vascular issues? Do we know that recovery is complete, or are there long-term impacts depending on the individual?
That's a really good question. And we're beginning to study that now that we recognize that this may in fact be, first and foremost, a blood vessel infection. COVID may be a virus that infects blood vessels, and which would explain so many things. It would explain the increased rate of heart attacks, the increased rate of clots and pulmonary emboli. And I don't know if you've heard of these COVID toes, where people develop these small sores on their toes that very much resemble chilblains, which are these little pain sores that people get on the reason when they're exposed to cold air. In case it's thought that these are the result of compromised tiny vessels in the digits that lead to these sores, which do recover. So the question is, what are the long-term implications when somebody has COVID and they have vascular problems associated with it? I would argue that full recovery is possible, but depending on the particular patient, their totality of risk factors, their age, previous medical history, it may not be that people fully recover. I can tell you that after somebody has a heart attack, there are repercussions that are indefinite, right? So, and then when somebody has a blood clot or a pulmonary embolism, some things change on a permanent basis for that particular individual. So I think it's safe to assume that for those who suffer vascular complications associated with the virus, that there are probably likely to be some long-term implications from that. Doesn't mean that it's a death sentence, but it means that probably people need to be much more careful about blood pressure management, cholesterol management, perhaps more regimented surveillance overall than they might otherwise be. That's the best information I can give now. But we're going to learn more and more now that we're increasingly recognizing that it is probably a blood vessel infection, at least in large part.
Thank you. Another question is there any, I'm sorry?
I just wanted to, I hope that made sense. That's all.
Oh, I think so.
Okay.
Is there any, another question was, is there any truth to that blood type has anything to do with your susceptibility to getting the
Well,
virus?
there have been some observations that people with certain blood types may be less prone to get ill than others. But those studies are strictly observational at this stage. They need to be reproduced in large numbers in order to be able to know with any degree of certainty to what extent that's a factor. We certainly don't know what aspect of the blood type it is that might confer that benefit. But we are seeing some reverberations in that direction. People have been asking me for the last 3 weeks, what's my blood type? You know, and that's not something we normally check in the course of doing a physical, but people are asking for the blood test, and if they want it, I'm offering it to them. It's usually, the blood types are usually checked in anticipation of blood donation or major surgeries, the potential for a need for blood transfusion, but otherwise it's not routinely checked. But it may be that those with the B blood type perhaps are at somewhat increased risk for a more severe disease than other blood types.
Thank you. We had a few questions about reopening. One of them was somewhat, does cooking or refrigeration kill COVID-19? How safe is it to eat in a restaurant where no one has an idea about how well the COVID-19 rules are being followed in the kitchen? Can I cook food for the other part was, can I cook food for my friends to be served on my outdoor patio with social distancing?
I think, okay, good questions. Generally speaking, freezing cold temperatures are not necessarily detrimental to this virus. We know that heat is detrimental to the virus. It's surrounded by a fatty shell, so to speak, that is easily destroyed with heat. So cooking ought to decontaminate any foods that may potentially be affected. And in restaurants, that I would say the same rules apply. With cold foods, you know, a shrimp cocktail, for instance, or something along those lines, salads. Potentially, there's some risk there. You know, we have to hope and assume that restaurants are following guidelines. And I do believe that no restaurant wants to be tagged as a potential ground zero for a second wave of COVID. So in my experience, what I've seen, and I have been to, full disclosure, 2 restaurants, outdoor seating, distancing, masks, and gloves over the last couple of weeks. And what I saw was very reassuring. I wasn't in the kitchen, but I can tell you that the staff are constantly changing gloves. They're purelling their gloves between each visit to a table or changing their gloves. They're wearing masks. They're crumpling up and disposing of the paper menus as soon as the table's done looking at them. And I'd have to imagine that these same measures are taking place behind the scenes as well. I don't know of any mechanisms currently in place to inspect these facilities. That would be an interesting idea, actually, a surprise inspection just to see that people are following the rules. But I think that everyone's sort of interested in doing the right thing. And they want to stay in business. They don't want to, restaurants don't want to be, as I said, a ground zero for coronavirus. That's the kiss of death from a business standpoint. So I have a little faith that restaurants are doing the right thing. They're washing their vegetables. They're wearing gloves when they're preparing food. They're wearing masks, and they are screened every day by the business owners for any signs or symptoms of illness. And they are doing temperature checks. I happen to know that for sure. So I think they're being as careful as they can be.
Great. Thank you, Larry. Those are pretty much the questions that were submitted in advance. Are there other questions that those of you who are listening tonight have? You're welcome to, here, and we had one just entered. Do you have any recommendations regarding handling of groceries brought into the home?
Good question. We're pretty careful in our house. You know, we when possible, we're primarily we're still getting curbside pickup and delivery. So if we go to the curbside, we wear gloves. We put a bag in the back of the car. I take off the gloves to drive my car because I don't want to contaminate my steering wheel, right? I then put on another pair of gloves to bring the groceries into the house. And then usually my wife will put on gloves and unpack the groceries and cleanse the packaging, either with a Clorox wipe or a Lysol wipe or something like that before storing it away. So we do that. We wash produce as we otherwise would. But I don't think and that hasn't changed, even though things seem to be lightening up a little bit, we're still practicing those same guidelines, and I think it's reasonable to do that.
Okay, thank you. Do we have other questions out there? This is your opportunity. You're welcome. You are welcome to even unmute yourself and ask a question at this time.
I see something about prospects for a
yes,
second
sorry.
wave.
Thank you. Yes.
Something popped up.
Yes.
Is that the question? What are the prospects?
Mm-hmm. What are the prospects for a second wave? What can that look like? And will the schools reclose?
I think I think we need to be fluid. It is likely, if not certain, that the virus will remain with us to one degree or another until we have herd immunity, meaning either until 80% of the population gets sick, which I hope never happens, or until a vaccine finally comes onto the scene. So between now and then, it's safe to assume, and most experts will agree, that the virus will be with us in one form or another. There are debates as to whether or not it'll be just sort of a lingering sort of presence that we need to continue to monitor, and because of which we need to continue to practice hygiene and distancing and wear masks, etc. I would say that the majority of experts believe that another wave is more likely. The question is it one wave or is it more than one wave? The other question is, when will these waves arise? We're starting to see already that from other countries, South Korea, for instance, reopened a few weeks ago. They opened schools and businesses, and they started to see a big spike. So they had to reclose schools and businesses again. Maybe a week or two ago, a week and a half ago, they reclosed 500 schools because after reopening, they saw the numbers go up. So I think it's going to be important that we remain fluid and expect the unexpected. I think for our own sanities, we need to understand that although a plan may be in place, that plan may change. Schools may open in the fall and close 6 weeks later. I know that Boston University is opening in the fall and planning to end the semester at Thanksgiving. Part of me wonders if they're going to make it to Thanksgiving, because we're going to start to see more cases for sure as businesses open and people meet and get together, and business and restaurants continue to open and so forth. It seems inevitable that there will be some kind of a rise. Whether it meets the criteria of a spike or a wave, time will tell. I do think that as cold and flu season approaches, and I think Anthony Fauci today or yesterday made some comments about his concerns about the upcoming cold and flu season, there will be some degree of uncertainty and perhaps some chaos, because people will get colds and there will be flu. As I said, hopefully it may be mitigated if people continue to practice these measures, but there will be some version of a cold and flu season. And out of that, there's going to be a great deal of uncertainty. When they call their doctors, the doctor is going to feel comfortable bringing them into the office to be checked to see if it's flu versus coronavirus. Or are we going to have to resume some of these more aggressive telemedicine modalities in order to kind of keep people home and safe? But I think as that cold and flu season approaches and the weather gets cool and people are spending more time together indoors, it seems inevitable to some degree that there won't be a wave at that point. Hard to quantify the wave, but it seems inevitable that there will be some kind of a wave, and maybe even one before that. We'll see what these demonstrations lead to. We'll know in 3 to 4 weeks to what extent the Black Lives Matter demonstrations have led to some kind of an increase in cases, particularly in the cities where people are close together. Not at all commenting on the politics of that. It is what it is, and probably it's essential that it be happening now, but there will be consequences, I believe. So we'll have to see. Everything is fluid, everything's organic, nobody really knows. I will say that Anthony Fauci, who I believe has been one of the grown-ups in the room for some time now, he's been absent lately, but he did make some comments that suggest that he at least is very concerned about what this upcoming cold and flu season will look like.
Thank you, Larry. Another question is, anything new on the link to Kawasaki's disease and the impact on children?
Yeah, not much new on that. We you know, it's for those who don't know what the question is referring to, we have seen rarely in children who were previously presumed to be safe from this illness, from this virus, these severe systemic, potentially life-threatening inflammatory conditions that particularly affect blood vessels, the heart and blood vessels. Goes back to my previous premise. And I can, on that subject, by the way, if anybody's interested, I can provide a link to an article that helps to talk about that in pretty interesting terms. But it's a thing. We do see it. There are ways to treat it, but it's pretty aggressive, and we're not seeing increased numbers necessarily of that particular phenomenon. But now that we know it's out there, we're more obliged to keep a closer eye on kids than we previously had been. Most kids do very, very well. You know, parents worry about it, but it's a rare but real phenomenon that we now have to remain aware of. And it's out there. Kawasaki disease has always been around. It's an inflammatory condition that involves blood vessels in children. Now we're seeing it, or a very close cousin of it, in the context of COVID.
Thank you. We have a question about playgrounds. What is the view on opening local fields and playgrounds if individuals are taking precautions before and after play?
Well, I think a week from tomorrow, school playgrounds and outdoor facilities are opening. You know, so my opinion aside, it's going to happen. I do think that if parents and children are vigilant and distancing measures are maintained, and people keep their hands clean, then it's probably, given the numbers currently in our community, given where we are right now, and that's always an important factor whenever any community makes decisions about businesses or schools. It's in the context of what's going on in that community at every given time, which is why we need to be so fluid. But in our town currently, I feel very comfortable that we can open up playgrounds with those measures in place, and as long as we are tracking any signs of reemergence of disease, for instance, with that How We Feel app, which once again, I can't emphasize strongly enough, everybody should download and use on a daily basis.
Thank you. What would make you feel comfortable to fly?
A vaccine. That's the answer. I hate to say it, but yeah, for me, I know people are flying, but my answer is, in terms of being comfortable flying, when there's a vaccine, I'll be comfortable flying.
Okay, right. Thank you. If you were invited to a close family wedding in another state in September, would you plan to attend?
Meaning, would I have to fly to get there? I'm assuming it would require flying to get there. I would have to think very seriously about it. If it were I'm erring on the side of probably not.
Okay. Now,
others will think I'm crazy, but you know, I'm not comfortable in airports.
What if you didn't have to fly? What if it was a car trip?
And a car trip with social distancing measures and masks and so forth, I think it would be reasonable. I wouldn't be comfortable attending a wedding with 500 guests all seated down in an auditorium anywhere in the world right now. But if it were according to the guidelines of that particular location in terms of the numbers of people allowed in a given place at a given time, I would be willing to consider that.
Okay.
Life has to go on. We just have to figure out how to, you know, and it's not black and white. We need to maintain our sanity and our dignity and our humanity. We just have to be as intelligent about it as we can be.
Yeah. Difficult balance to achieve.
Yeah.
As more things open in the fall, does that invariably avail us to a greater impact of a second wave?
Yes. Going back to the previous question, I think it's likely that as the temperatures get colder and as schools open and as people go back to business and as people are enclosed in spaces rather than being outside and spaced apart, that as with any virus, colds and flus and everything else, there will likely be an increase in COVID cases as well.
Okay.
That's kind of the main, that's kind of the big elephant in the room scenario that most people are concerned about.
Mm-hmm. Okay. And then how do you see the future of sports? For example, will we ever see a soccer game again?
I truly believe that we will. We will return to normal. When there's a vaccine, if not sooner, but certainly when there's a vaccine and it's distributed and we have herd immunity, a certain critical number, mass of people in our communities have been vaccinated and protected, we're going to go to concerts, we're going to go to soccer games. Life will return, but there's always going to be this sort of awareness, hopefully, that it makes sense to wash hands, sneeze like this, maybe not shake business associates' hands so often. Things probably ought to and will change as a result of this experience, because there's going to be another pandemic someday. And I know there was a question about that I don't think we've answered yet. There will be a pandemic. Throughout human history, there have been pandemics. It will likely be a flu pandemic. But we have other potential sort of germs lurking in the shadows as well that could potentially be problematic for us. So the more we're ready in terms of our behaviors and preparedness on a municipal and state and federal level, the better prepared we will be for that eventuality. So yeah, there will be another pandemic at some point. Nobody knows when. Could be 100 years. Could be 5 years. What I see is the differences between indoor and outdoor environments in terms of risk. Is that sort of getting at your question? There are certain factors that are critical in terms of risk for transmission from one person to another. One of them is distance. The closer you are to somebody, the more likely you are to be exposed to respiratory droplets or aerosolized virus, meaning that even if someone isn't coughing or sneezing, we know that breathing or singing or speaking can potentially allow virus to enter that immediate environment and linger in the air for perhaps hours. So the longer you are in the presence of somebody in an area where the air is relatively stagnant, where there aren't a lot of breezes flowing, circulating air, there is risk. And we also know that duration of exposure is important. So the sort of over-under that we're hearing in the medical community is 15 to 30 minutes. So if you spend less than 15 minutes in the presence of somebody who has the virus, the odds of contracting it go way down. Because you need to really get that. You need to inhale the virus in reasonable quantities down into the lungs in order to really be meaningfully at risk, which is why surfaces are considered to be potentially less problematic, because even if you touch your face, it may not get into the deeper lung tissue. So distance and duration are critical factors. Warm temperatures versus cool temperatures. If you're outside on a summer day, particularly when there's UV light and people are perhaps a distance from each other or swimming and their hands are being cleaned on a regular basis, there's certainly less risk than being indoors where those factors are not necessarily at play.
We have a couple more that have come in, Larry. How do you feel about hotels and motels?
Probably better than I feel about airports. Because it's more of a controlled environment. Theoretically, rooms are being cleaned after previous guests vacate, and if we all take it upon ourselves to keep our hands clean, maybe wipe down sink faucets and doorknobs when we go into a hotel room, it's probably a relatively low risk proposition. Busy hotel lobbies may be a different story, but in general, I think that that particular scenario is probably relatively safe. Okay.
And how would you feel about having...
Sorry to interrupt. In a community where there's not a lot of COVID.
Ah.
If that community is, if we're talking about one of these larger towns in Arizona where the numbers are skyrocketing, I wouldn't stay in a hotel in that town. So it really depends on the greater picture.
Okay, thank you. How would you feel about having service people or cleaning people in your home?
I think it's time to begin, allowing people to, to perform those services. Again, we have someone who comes to clean our house once in a while. Now it's like once a month, every 2 weeks. I'm not sure what my wife has arranged, but they when they arrive at the front door, they take off their shoes, they put on a mask, they put on a fresh pair of gloves, they do their work, and they leave, and we have moved into other rooms when they're there to minimize exposure. And it's for their sake as well as for our sake. These are people who generally are not, their resources are somewhat scarce, so they don't want to take any chances. They can't afford to get sick. So if people are taking precautions, I think we had to have our air conditioning repaired a week ago. The guy had to come in the house, So it's a case by case scenario, but I think in general, allowing service people into the home, not a team of 10 service people perhaps, but 1 or 2 guys or gals, it makes sense to begin doing that, in my opinion.
Very good, thank you. And let's see, how likely is it that we will develop a safe and effective vaccine? Is it possible that we won't?
I would say it's very likely that we will. And as we discussed earlier, it's probably going to be available to the general public, a year and a half from now. Maybe sooner if things really move along. But the testing process, the vetting process takes a long time. And we can't have a vaccine that is not safe or effective. It makes no sense. So we need that information in place. Some have speculated that there may not be a vaccine available anytime soon, if ever. For instance, we still don't have a vaccine for the common cold, right? There are some bugs for which the vaccines simply have not been discovered. Because so much time and emphasis is being placed on this particular virus, and particularly because so far it hasn't demonstrated a propensity to mutate aggressively. I'm hopeful, I'm optimistic that we will have an effective vaccine, but not right away.
Good news, though. That's good news.
Yeah, I'm optimistic. As I said, and we will go back to concerts and ball games and all. And we'll get back on airplanes and all that will happen. That's my prediction.
Very good news. Just a follow-up question on the hotels. What about swimming pools?
I think being in the water in a swimming pool is actually relatively safe. I mean, you're essentially washing your hands and face every time you get in a pool. Virus has not been shown to transmit from one person to another to any meaningful degree in a pool or a lake or an ocean. I think the pool environment where people are sitting together and kids are playing and jumping on each other could be problematic. If people are playing chicken in the pool where they're grabbing each other's faces, that potentially could be problematic. But if people are immersed in the water and they're reasonably distanced from each other, I don't think that's a significant concern.
Okay.
Does that make sense?
Yes, I think. Thank you very much. Can you talk about the risk related to age? My wife and I both have parents close to 90 years old, but they are still shopping while following guidelines. How dangerous is this?
Well, it's more dangerous to someone in his or her 90s perhaps than to someone in his or her 30s or 40s. Yeah, COVID thinks that anybody over 50 is old, right? Is a high. That's when the numbers start to jump up, 50 and up. So, I think the risk is greater, but if the environment is safe, if people are practicing the measures and in that particular community, the numbers are down and not climbing or stable, then I think it's probably reasonable. I think I've seen what I've seen in grocery stores is that they're being very careful. There are lines on the floor that, force people to kind of keep their distance and wait until their turn to get to the cash register. They're limiting the number of people who traffic through the place. So I think it's a reasonable, and it's particularly for people who are otherwise limited in terms of their activities and their social interactions and their ability to get out of the house. Mental health is really important. So it's a balance, So I think entering that realm intelligently is reasonable. When they get home, they should be gloved, and they should wash all the packaging and so forth, the way I was saying that I do in our house. and if they follow those measures, I think I'd hope and expect they'd be okay.
Thank you, Larry. As far as being outside, how far can the wind carry the virus? Is it even known? And how far behind someone should we be if we are cycling or running?
We don't know precisely how far a virus can be carried. Theoretically, it could be carried as far as that breeze takes it. It can remain viable in the air for up to hours, right? So, but as the wind blows it, it disperses to such a degree that it seems logic would dictate that if you're in a reasonable distance away and a breeze comes at you from the direction of someone who had been sick, it seems unlikely that would be a high risk proposition. What was the second part of that question?
The second part was, how far behind someone should we be
right.
if we're cycling or running?
I think cycling, if the cyclist or runner is wearing a mask, it's hard to cycle or run behind someone 6 feet, right? I mean, by definition, the likelihood of you crashing into them is pretty significant. So I think it's sort of self-selects in that regard. Some studies are looking at 10 feet as more reasonable perimeter. So I would say that, keeping a 10-foot distance is probably reasonable, assuming everybody's wearing masks.
Great. Thank you. Well, again, Larry, this has been wonderful, very informative.
Great, thanks.
Your time and expertise.
I appreciate the opportunity.
Not very often that we get a doctor right here to ask all these questions. So thank you.
Well, happy to be here. If you need more help, just let me know.
Great.
And I hope you all stay safe. Download the app, How We Feel. Wear your masks, wash your hands, keep your distance, and stay positive. And be prepared for change, but we'll be okay.